Hi, guys. Welcome to A Little Help for Our Friends, a podcast for people with loved ones struggling with mental health. Hey, little helpers. It's Dr. Kibby here. Before we dive into this episode, I wanted to tell you how I could help you navigate the mental health or addiction struggles of the people you love. Cool Mind is the online coaching platform and community that I built to support you in the moment when you need it the most, like having hard conversations, asserting your needs, or setting boundaries. Even if you're just curious and want to chat about it, book a free call with me by going to the link in the show notes or going to coolamind.com, KULAMIND.com, and click Get Started. Thank you and enjoy the show. Welcome back, little helpers. We have a really great guest today. His name is Dr. Jonathan Avery, and I'll tell you a little bit more about him, but he is such a key figure in the world of addiction psychiatry. So really understanding addiction, how it works, how we treat it, and involving family members and loved ones in the recovery process. So he is like a big hero of mine. I've only chatted with him a couple times, but he has already inspired a lot of what I do, supporting family members and loved ones and people with addiction. So he is, just to tell you about all of his accolades, he is vice chair for addiction psychiatry and professor of clinical psychiatry at Weill Cornell Medicine. This is where I did my internship. That's how I know about him. And he directs the Addiction Psychiatry Fellowship and founded the program for substance use and stigma of addiction. So he really pioneers a lot of amazing research and training in combating the stigma of addiction, the silencing and the judgment around people with substance use disorders. He also founded the SAFE program, the Support, Advocacy, and Family Education program, to provide evidence-based support for families affected by addiction. That is awesome. That's a virtual program that basically has all these different addiction experts giving webinars that is free and available to anyone. Like the one amazing webinar was about just how addiction works in the brain, or vaping addiction. So I think that's the SAFE program is super, super cool. You should definitely check that out. Dr. Avery also serves as medical director of the NBA's anti-drug program and is the host of Thriving with Addiction podcast. He is also, he's coming out with a book called Thriving with Addiction, which will be released later this year, 2026. And he's just a superstar. He has published extensively on addiction, stigma, and evidence-based treatments. He has edited and authored 10 books and serves on national editorial boards. So he's also just a really nice guy who has both personal and professional, deep understanding of addiction. And so I really was like geeking out in this conversation, just asking him all these different questions about why there's still so much stigma about addiction versus any other diseases. What can family members do? What is the best thing for them to do in this really hard situation where someone they love is addicted to something like opioids or drinking? But this is a fascinating conversation. So if you or anyone else struggles with addiction or has struggled with addiction, this is an episode to listen to. So hope you enjoy. Welcome back, little helpers. We have our very special guest, Dr. Jonathan Avery, here to talk about stigma and addiction and everything about that. So I am so excited to have you here. Welcome to the podcast.
Thanks for having me, and thanks for all the good work you're doing. It's nice to collaborate around these important topics.
I know, it's nice to connect on with people with similar interests, because addiction and substance use is really interesting to me. First of all, I don't understand why it's a separate world than mental health. Do you know why? There's like mental health and then they're like, and addiction. Why is that?
It's always been the stepchild of mental health and medicine in general. I think part of it is, the history of 12-step tradition plus the sort of thought that it was more of a moral failing than a disease model.
Awesome.
And I don't think it's really been integrated fully into medicine and mental health and really until the opiate epidemic almost, because that was one condition that really was taking people's lives, that needed medications. Like for opioid use disorder, you need to be on medications and psychiatric medications, and psychiatrists took the lead on that. And so I think one consequence of the opiate epidemic was the increased sort of medicalization of of addiction, and with that came more recognition that it is a mental health condition and a disease model. But if you went to a doctor, even a psychiatrist or a therapist 30 years ago, and you said you were drinking too much, they would say go to AA, basically. And then over time we've tried to address it more.
My God. So that's not that long ago. That's pretty recent where it now I understand why stigma is such an important part of like the history of how we understand addiction because that seems silly. But
No, it's ridiculous. I mean, when I was, in training in medical school, which was, 15 years ago, I was pretty much told that it was not for doctors and therapists and psychiatrists to go into addiction. That was one of the reasons I was discouraged from going into substance use. It was the thought that, that's not real true medical care. That's not really addressing the psychiatric conditions, and we should leave that for, the support groups more than anything.
whoa, okay. Well, I didn't know any of this. So tell us about your journey to doing what you do, and then also like how did you cross over from you're in your training, it was like this is not psychiatry. Yeah, tell me everything. What's going on?
Well, I was always interested in medicine. My dad's a doctor, and he was a hospice physician. And his big thing with hospice, which is taking care of people who have less than 6 months or less to live, was that people at the end of life often didn't really have a voice or felt they didn't have a voice. And he thought a lot of his job as a hospice physician was to give them a voice, to help them tell their story, to not be afraid of death, and also to involve family members in that process. He was big early on sharing stories, having the person who's dying share their story, even writing it down for family members. When I was in high school, I would video record back then people in the end of life telling their story, and they would then have that video to pass on to their grandkids and their loved ones. They studied that type of intervention, sometimes called dignity therapy, and showed that it really helps the patient, helps the families. And so I was really inspired by, the kindness that my dad showed, and also sort of trying to help people who don't, feel like they're empowered to feel that power to tell their story. Also, growing up, I had family members struggle with substance use, and loved ones and friends, and I didn't have a name for it, but I recognized that they too were sort of silenced and stigmatized in a way I didn't see with other health conditions. And so I thought it was something that was interesting how society treated folks who were struggling with substance use. I was treated different than other medical conditions. And so I knew as I was growing up that it was something that I was interested in learning more about. And so I made my way through college, studied philosophy, and then medical school. And then medical school, I was a little unclear what I wanted to do. I thought maybe surgery, maybe psychiatry, because I was interested from my experiences with my dad. But then in medical school, I realized, or I was told to not study addiction, that it really wasn't something we're studying. And I noticed people in the hospital who were having their voices silenced, I felt, and weren't telling their story and were being marginalized. And then sort of against advice from everyone, thought, you know what, this is something I really feel passionate about and want to dedicate myself to. And I decided to be an addiction provider and to study stigma, the stigma of addiction that exists in the places that should be the safest.
That's super cool. Can you paint a picture for me what the silencing or stigma looked like, even in your family or in your patients? Like, I feel like many people talk about feeling marginalized or kind of lost in healthcare system, right? Of all kinds of conditions. But what did it look like with people with addiction?
Well, what I noticed in my family, and then similar to the people I was seeing as I went through my training, is that you feel judgment at so many levels. You feel it from your family who feel like you should just do better. You feel it with your friends and places where you work where you can't sort of endorse it. Like you talk about a medical condition at work and go on leave for it, but there's the feeling that if I was struggling with substance use, I couldn't tell anyone,
Mm.
that I had to really hide it. And then I had people growing up that ran into trouble with the legal system, and I saw the way that they were sort of punished and deemed bad people as opposed to people worthy of care and compassion. And so I saw it in my own life, and I saw it in spades in the hospital setting. I mean, it's the percentage of people admitted to a medical hospital at any time, like a quarter to half of them have active substance use disorders. It's so much of what we treat. And similarly, I noticed that they didn't feel safe to talk about it. They felt if they endorsed it, they were treated poorly. They often weren't offered evidence-based care. And you sort of learn, like when you rotate in the emergency room, prioritize the people with the real medical conditions, the heart attacks over the people who are in withdrawal or struggling with other things. And so the whole system, family systems, legal systems, the medical system seemed to be pushing folks with substance use disorder to the secrets, telling them they were bad, sort of on the face of it, endorsing it's a medical model, but then treating them as if they're moral failings over and over.
And why do you think that is? When you just said heart attack, I was thinking of like the role of choice and how there is probably a misconception of, oh, you're choosing to drink. You're choosing. This is something you want to do and you can decide not to, but you are, and it's causing problems. But you just said heart attack, and I was thinking about people's diet and whether someone exercises or whether someone eats a lot of red meat, and that could cause heart attacks. So why do you think that substance use got it such a different stigma around it?
I think that's a good analogy. Often it's people say, oh, heart attack, heart disease, cancer, very different than addiction. But in fact, they're almost the same. There's a huge genetic risk for all of those things. In fact, the genetic risk of addiction, substance use disorder, is something like 50%. If your mom and dad have it, you're super at risk of developing a substance use disorder. We know then it sort of insidiously develops over time, hijacks the reward pathways, hijacks so many different parts of the brain and the body to a point that making a good decision is almost impossible. It gets really hard to make a better choice. Um, the difference is, though, in that the end, sort of how it presents to doctors or to family members, still looks like choice, and I think that's hard for folks. With a heart attack looks like dead tissue in the brain. The substance use looks like the person who's still drinking, buying alcohol or using opiates or smoking weed. It's a behavior that's continuing, and that can be hard to equate with sort of laboratory values of a heart attack, I think, at times. And we see this with mental health sometimes. I know it's gotten better. I mean, historically, we would say the person who's depressed just needs to do better. Now we understand there's all these things happening in the brain, but we can't quite equate the substance use behavior with what's going on in the brain in our minds just yet. And for what it's worth.
Perception of this disease change from being little Jonathan before being Dr. Avery to now Dr. Avery? When you grew up with it, you saw people struggling, you didn't have a name for it. And then now, not only do you have a name, but you probably can list the different mechanisms and all the different factors that could increase the risk. Like, what, what, take me through the progression of like what you understood it as a loved one, and now as a specialist in this.
When I saw it in friends and family, I heard people saying it was bad behavior, but for some reason that never clicked with me intuitively. I thought there's something else going on here. People I love, I know they didn't want to wreck their lives. Like it felt like wrong to think that someone wants to grow up and be the best addict on the block. That it wasn't adding up to me why we were treating these folks so poorly, thinking that this is how they wanted to be. And for a lot of folks, I saw them doing the best that they could and still failing repeatedly. And so I was just very confused when I saw people really struggling that we were gonna then punish these people. That felt wrong to me, and not helpful. And I think the bigger blow was when I saw it happening with people that I thought would know better, like doctors and lawyers. Like I think the biggest like disappointment was when I entered sort of the medical training and I saw that doctors didn't have different attitudes than what I was seeing around me. Like I sort of had this feeling that when you become a doctor or a lawyer or when people grow up, they sort of are enlightened, and to discover that wasn't true was like a double injury for me, and really what catapulted me to want to study this and help us all do better around this topic.
Mm. So interesting. And like to hear that your interest and passion grew as you saw like how this doesn't make any sense. Like what like all the different logic of wow, these are the kind of people who should be able to stop or be escape this problem, but it's like no, everybody, including doctors who know better.
Right. And part of my experience too was that the people that I knew who were struggling with substances were some of the best people I knew, like the kindest, most loveliest, who felt the deepest, who I wanted to be around. Like it didn't align with how other people saw them at times. And that really, you know, and then so I imagined as I was in this medical setting, like other families bringing their special person in to get help, and then feeling rejected, and that felt very wrong.
Yeah, you remind me of something that my mom said once, where she said, I was talking about a friend who recently got sober, and she was like, does he have a soft heart? I was like, what are you talking about? She said, I feel like people like me and others who struggle with alcohol, we have soft hearts, maybe too soft. Does that resonate, or is that like, is there like a personality trait that tends to go into?
I think, I mean, historically, I think people thought there might be, but it really does impact everyone at the end, and it's pretty non-discriminatory. And I mean, there's so many factors that go into why someone develops a substance use disorder. At times it is sort of self-medication, I guess what we're sort of talking about, someone with sort of sensitivity to different things or anxiety and depression, people that feel more. And we know if you've had trauma, if you've had mental health struggles, that does increase your odds quite significantly, 2 to 3 times of developing an alcohol use disorder, even um, notwithstanding the genetic loads, certainly having these adverse life events and feeling negatively. But also sometimes just environment and, you know, luck conspires against one, where you're in this environment where you get exposed to something and you start taking it, and before you know it, even without mental health issues, even without X, Y, or Z trauma, you end up getting stuck on that. And then we saw that a lot in the opiate epidemic. People taking meds prescribed by a doctor in good faith, thinking it was the right treatment for a pain condition or something else, and ending up with a substance use disorder, just because of doctors prescribing, for example.
Do you see different pathways or different stigma perceptions from others with the different kinds of substances? Like if someone is a drinker versus, um, hooked on oxy or anything like that. Do you see differences in that, or is it like you're an addict?
No, there are different. I mean, my work shows we've studied a number of clinicians, family members, lawyers, and the findings are pretty consistent that attitudes are worse towards those with substance use disorder than towards any other medical or psychiatric condition, like profoundly worse, and that they tend to be worse for drugs versus alcohol. So alcohol gets a slight pass. I mean, it still has that it's so widely accepted in society. When people start using opiates, and opiates are almost aligned with nicotine and some of the other substances, attitudes are even worse than towards drinking. But it's really striking how much more negative attitudes are towards
Hmm.
folks who use substances.
How so? Do you talk? Did you get in that work any qualitative like what are the judgments or?
We've used a couple scales. The main one we've used is the scale called the Medical Condition Regard Scale, which assesses different attitudes, in terms of like how much do you think they're to blame, how much time you would spend taking care of them, thinking about them, do they annoy you? It captures sort of, depending on how you create the scale, but around 11 different sort of beliefs around a person who's struggling with substances. It's not perfect. It doesn't capture all the things that go into stigma, but it gives you sort of a rounded picture of how someone might feel to any given health condition. And so we basically, in my studies, we present a person, we describe them, try to keep it, um, we try to create sort of people that are similar, but the one thing that differs is their health condition, be it diabetes, cancer, depression, or a substance use disorder. And then we ask people how they feel about these little vignettes that we present to them based on the scales. And it's if the person is struggling with substance use, the attitudes are much negative. And we've learned that some things do improve attitudes. For example, if someone does believe in a disease model more than a moral failing of addiction, their attitudes improve. For doctors or lawyers that really choose to work with these folks, like addiction psychiatrists or public defenders, their attitudes are better. For family members who have struggled themselves, sometimes their attitudes are better than towards family members who haven't struggled.
That's interesting. Well, people who have more knowledge about it, I guess it makes more sense that they, are more compassionate or they understand the complexities.
Exactly.
Um, Tell me about, I mean, this is more from my own curiosity. What did you're saying that the opioid crisis has shifted perceptions. What else has it shifted? I mean, I get just I feel like I don't hear about it as much now, and I don't know if the current administration is as focused on it or if it's getting better, but there seemed to be a huge shift when opioids swept the nation. Like what changed? What happened in your practice or
Well, we always say in the world of addiction, there's all substances of misuse on one hand, opiate use disorder or opiate misuse on the other hand. And the reason we separate them out, one is in terms of how opiates present. One, as I was saying earlier, doctors way overprescribed opiates in that first wave of the opiate epidemic. Then we cut down the prescribing and heroin came in. And then finally, all the synthetic opiates like fentanyl flooded the drug market. And so sort of the genesis with doctors playing a role, plus all this, fentanyl that's super potent coming in, really raised all these alarm bells and resulted in all these deaths. Like you don't die with other substances the way you die when you're exposed to either intentionally or accidentally to these opiates. And so that really makes it the red light emergency in medicine. But what really caused us to take it on more as time went on is that the evidence for how to treat opioid use disorder is strongest with medication. So treating it with medications like Suboxone or methadone or Vivitrol. And because that data is so strong and needs to be prescribed by a doctor, I think medicine increasingly has taken it on as the thing that they can address and should address, no matter what kind of practitioner you are. And then with the risk of overdose, harm reduction efforts are so important. And so everyone, should be carrying Narcan kits and doing and testing their substances. And there's a role for doctors and healthcare systems to play in that. So all of that led to sort of a more medicalization, a more active interest and training in doctors to address it. I mean, for example, when I was in residency, almost nothing on opioid use disorder. And as the crisis increased, suddenly we had mandatory classes in med schools in every residency, mandatory exposure to treatment settings where people were getting opioid use disorder. Everyone here gets Narcan kits from the beginning. And so, more and more it was incorporated into the training and education of clinicians.
I was thinking about like maybe the 80s or 90s. I don't know much about it. It was just like what you see on TV, but there was all sorts of like quaaludes and speed and amphetamines that were popular according to like Saturday Night Fever, whatever movies. Now I'm the 70s.
Right.
But that seems also like something that would be prescribed for like weight loss or whatever they did, and then it kind of went haywire and got into the street like speed and stuff like that. But that didn't have the same shift that opioids do.
Not quite into the medicalization of the treatment for substance use disorder. I mean, part of the overprescription of quaaludes and benzodiazepines for that matter, I mean, part of the way those took over was the same playbook in some ways that was used on opiates, with direct-to-doctor marketing and encouraging people to overprescribe it when the indication wasn't quite clear. But they didn't kill people the way opiates did. I think the real concern around opiates was just the deaths. Like we hadn't seen something that we prescribed really causing so much harm before, like we saw with the opiates, and really seeing it devastate a nation, drive down the life expectancy of Americans. And then the way that once we cracked down on the overprescribing, that fentanyl and other stuff came in, it was almost hard to believe how it took over.
I'm I'm wondering. I'm wondering what family members or loved ones should do if they it okay. Going back in my thoughts. I When I first met you, you told me about craft, community reinforcement and family training. And so when I did that, I went and got certified because of your advice. And it's I still don't understand what family members should do when they're afraid that their loved one, like their child or their sibling, is going to die, right? Because like the idea is, step back, take care of yourself, set boundaries, like all the stuff I want to talk about. But what do you do when that person is at risk of death, right? If like how can a mother say no to giving money or giving housing or any other support if they're afraid that their kid is going to leave their house and possibly overdose?
Right. I think the advice to family has changed because of the opiate epidemic. I mean, I used to, especially in certain settings, hear the advice to let people hit rock bottom first or get to a state where they were completely motivated for change themselves and to sort of just back off and let it happen. But you really can't do that with opioid use disorder because the risk of doing that is accidental overdose and death. And so we've sort of changed our narrative from I was always suspicious of this narrative to start, I'll say, and we can talk more about that, but changed it from let them hit rock bottom to lovingly support the bottom. And part of that is approaching them, still taking care of yourself and not doing things that, directly encourage use, but at the same time being there to protect them, give Narcan if necessary, increasingly encouraging people to, give them housing or put them in safer settings. And that's not always possible, and there's a lot of variables that go into each family system's decision making. But it's like you wouldn't let someone with cancer reach stage 4 before you intervened, and similar with opioid use disorder. You don't want to wait to they're at that final stage before you say, oh, let me do something. You want to try to keep them alive and keep them in a spot where change is possible, and that's not possible if they're using in a way that could result in their death.
What about let's say you have yeah, do you have kids?
I have 3 kids.
You have
Yeah.
3 kids. Good for you.
Yes.
How old are they?
They're 12, 6, and 4.
Okay. Okay. So my kid's little too. So imagine you have a 20-year-old kid and he or she calls you up and says, Dad, I need $500. And that kid is struggling with addiction. And most likely they're going to use that $500 on something like that. What do you do? What would you do?
Well, my hope is with my kids, from the very beginning, we're talking about substances. Like the current recommendation is to start talking about mental health and substance use at the age of 8 or 9, and not the edge of the bed conversation where we say if you use drugs I'm going to kill you and then disown you, but really to highlight that it's something important, it's something we've seen in our family, that's something we have to be mindful of, and often almost to telegraph how you imagine dealing with things if they arise and what treatment is a little bit, and just as not in like a lecture type way, but as you have so many moments with your kids as they grow up where they'll see people struggling with mental health, you'll see people struggling with substances, they'll wonder why so and so in the family is struggling with substances. I would use each of those moments as a teaching point so that when the crisis hits, it's not like the first time the family unit has ever handled it. How I'll handle it if the crisis hits when my daughter's 20 and is using substances, I'm not sure. I mean I and how much to give that $500 versus not, how much to support it or not, especially when they're out of the home, is gonna make me lose whatever little hair I have left, for sure. It's not easy. My hope is though that I have that connection there, and we have the ability to talk about it where we can sort of lovingly set boundaries if needed, but that there's never a question about the love. There's never a question that they have a safe space to come home, or to even acknowledge that use is happening, and to make sure they have Narcan kits and are staying safe. And If I'll be able to do that in the moment when I'm freaked out and can't believe it and feel like using my big dad voice to try to scare it out of them, I'm not sure, but I think that's some of the hope. But I recognize how hard it is. Like I've learned that as kids grow up, like all this advice I'm giving parents when you're in the middle of it, it's like, oh boy, it's hard.
Yeah. I mean, I'm terrified having alcoholism in my family. And then, not just that, actually, some of my extended family members have struggled with opioids as well. The thing that scares me on either side is when you're talking about, oh, it's a disease like any other disease, like cancer, that is like, oh, okay, so it's not our fault. It's not it's not something that we did wrong. But when it's not something that you did wrong or right, it's totally out of your control. But if it's something, but on the other hand, if I want to look at like, there's something I can do about it as a parent that has its own scariness, right? I can do something, but if I mess up, my kid's going to become an addicted to something. So how can parents or family members in general see their role in that?
It's the name of my upcoming book and podcast is called Thriving with Addiction. And the spirit of that is that addiction's not going anywhere. It's in all of us, it's in all of our families, and there's no sort of like overcoming it, but it's sort of like recognizing it in each of us, our potential for it, and really developing sort of fitness, as much mental fitness and fortitude and health as we can with it. Just like you would if you had a heart disease, you would then be very attentive to diet, you would take the right medication to lower your cholesterol and your blood pressure. You would check your pulse more frequently, you'd visit the doctor more often. And so if you're at risk for substance use and mental health, you want more check-ins around it. You want to, check in with how much you're drinking and using. You want open family conversations about it. You want to make sure you're addressing, mental health issues as they pop up and maybe doing so more aggressively. Maybe if you have less genetics risk, and you have, a week or two where you're drinking more than you want, you don't pay as much attention to it, but you should pay attention to it if you have these risk factors or have gotten in trouble before. And so the hope is that the family unit can be attuned to that, and each individual can be attuned to these risks and keep their finger on the pulse of it.
Besides for knowing that addiction is in the family, what other huge risk factors or flags are there before someone develops an addiction? Like I'm thinking about, let's say hypothetically, our kids are in their 20s, they're drinking, going nuts in college, and then like how can you tell at that point who's going to have a problem with it and who's not? Or is it just a matter of time or
This, unfortunately, we're hopeful one day you'll be able to come to a doctor or an addiction doctor, and they'll give you this printout of like all your risk factors, what the genes are, and they'll say, look, your odds of developing a substance use disorder with drinking is 1 in 2 or something like that. That would be nice. Like the best we can do really is say, look, if you have a family history, if you struggled with mental health issues, if you had trauma, those are really the biggest predictors that we have right now. It feels inadequate, and one person can have all those things and not develop a substance use disorder even with exposure, another can. So we're missing a lot of the contributing factors, even still. And so really the best proxy is if you've had a loved one who's been struggling with addiction, in terms of understanding your risk. And then the unfairness of it is that, yeah, a lot of people will go to college and drink or will get some exposure to nicotine. And, you know, about 1 in 4 of people who do that will end up with an alcohol use disorder. 3 out of 4 will get off scot-free because they didn't have some of these risk factors or just got lucky. But 1 in 4 will have it. And when you develop a substance use disorder in those early years, that's always the thing that feels so confusing. Like, I was drinking as much as X, Y, and Z. Why is it impacting my function and me in the way? Why am I having this outsized reaction and this mental obsession to drinking more? It feels sort of not fair and random almost.
yeah, yeah. What about so when I was on internship at Cornell, I did the rotation in the ER, and it was so interesting. I hadn't thought about this until I worked there, where I saw that there were some kids, usually in their 20s or 30s, um, had, they were just partying more. Maybe they were smoking weed or they were drinking, and they had a manic episode or they had psychosis. Do you think do you think that they had like a genetic vulnerability to that, like they were already at risk, or do you think there are really some people who, that kind of drug use or partying too hard could actually create or trigger those kind of episodes? I still don't actually know.
I
Like,
mean, we,
like were those people always going to have like a risk of bipolar disorder or something, or is it just like anyone, if they do enough drugs, that they could get there?
we do think, in terms of how a mental health issue develops, we often think of sort of multiple hits that can result in it occurring. There's certainly the genetics behind it. There's early life experiences, there's trauma. But one of those modifiable risk factors to developing mental illness is substance use. And sometimes it's tough to separate out from the mental health because sometimes the mental health thing emerges and part of the reason people use is to self-medicate that. But sometimes the substance use does uncover sort of a risk for a substance use. And where that's been most striking has been with marijuana over time, where, in the 70s, it was very rare that marijuana use would result in psychosis. There used to be this thing like called hemp psychosis, and the older addiction psychiatrists talk about if someone came in with weed-induced psychosis, like the whole hospital would come down and say, "Wow, this is the strangest thing I've ever seen." But weed has increasingly been more and more potent these days. It's so much more potent than it was in the 70s and 80s, the ways to use it all the time. And so increasingly, we're having more and more people that present with marijuana-induced psychosis or manic or depressive symptoms from these high potency marijuana products. And we never saw that historically. And so we think that, yes, it probably uncovered something, but it could also, even more than that, just create something given the potency of it. And that's scary. And then certainly more potent things like meth and cocaine can also do the same as well.
Yeah. Yeah, that's interesting. There's been a couple of parents who they're dealing with their kids having, a whole host of mental health issues and going in and out of the hospital. And there were and two of them in my mind that they were like they were fine until they started smoking weed. And so smoke and weed caused their mental health issues. Um, and I was like, I can't say if that's true or not. Like I don't like what is cause, but I was like, I don't actually know if that's true or not, and I can't say either way.
Yeah, it's hard to separate it out and to say it's true. Once it's developed though, it's very clear you want to avoid it.
Uh-huh.
So regardless of that's what I always say when people present like, all right, whatever got us here, it's a complex thing, the brain, and neither you nor I are going to be able to disentangle it, but it's pretty clear your outcomes for mental health issues once you develop them are much better if you minimize or really cut off substance use. And the main thing that really impacts people's mental health, is alcohol. Probably that's still the thing people drink the most. And we're increasingly learning like even one binge episode a week, and binge is less than people think. Like 3 to 5 drinks for a man, 2 to 4 drinks for a woman, can really result in a anxiety episode, a depressive episode. And so if you're at risk for mental health or have had mental health struggles, minimizing substances is really key in terms of mental fitness going forward.
Mhm. Good to know. Okay, good to know. Yeah, because I think these parents are worried that their kids were continuing to smoke weed, and they're like, "Oh, it's the way I relax." And
It's hard to talk to anyone about weed these days. I mean, weed has this perceived safety. It's legal now. It's everywhere. I mean, you and I are in New York. It's the smell of New York. Everyone's doing it. And again, just like with, 1 in 4 of the college drinkers who are drinking too much is going to have a problem. The rest are going to be scot-free. A lot of people that smoke weed are going to be able to smoke it, some every day, and not get into problems with it. But there are some folks who it will be a problem. And especially if you've been struggling with mental health, it's sort of like the easiest, simplest thing to do to make sure you do your best with it is to not smoke.
interesting. What are some of the best things that you've seen loved ones or family members do to support someone with addiction, and what are the worst things that you've seen?
Well, I mean, my image before I became an addiction psychiatrist was of what family members did when a loved one was struggling was that sort of quote unquote Jacksonian intervention where people are like around they're in a circle and they're each reading a letter saying they're never going to talk to the person again unless they change their behavior. And I've learned that it actually seems like it might be one of the worst, most ineffective ways to tackle it. And I think the best way is sort of what we've been talking about, which is to just do your best to get out of the fighting and the shaming and just get into this and the yelling and the finger wagging to a point where you're just lovingly, supporting the person while also not, not creating an environment where they're using, or I hate the term enabling, but sometimes that's the simplest word to say, like enabling the use, but really are setting boundaries, but also you're there for them because they're your significant other, they're your son, they're your father, but doing it in a way that protects who you are and also but is there to provide some support. That's hard. That's asking a lot, and sometimes it is for severe substance use, or there's a lot going on, or there's violence or traumas. Sometimes it's best to disengage. But I've noticed that people do best when they keep that connection.
Mm.
When the connection is lost for the person who's struggling, then they're often just lost. It's really often the connection to family that's keeping people going. And when that's severed, it can be very hard to put yourself in a position to change.
I agree on one hand, but at the same time, I'm like, looking back at my experiences, there were times that it was so painful. Like you're basically watching someone you love kill themselves slowly, or maybe unintentionally. But it's just like I'm gonna have to watch that. It's so painful. They're not gonna listen to me begging for them to stop. And then there's that other piece of how painful it is to feel like you matter less to them than their drug choice. And so I mean, are there times that it makes sense for someone to cut off contact, or are you saying that that's really not advisable?
There might be times when cutting off contact is indicated, but it's a vicious disease that makes it seem, you know, I think everyone I've seen who it seems like they're choosing the substance over their loved one, that's not the case when I really talk to them. They just are in a spot where their brain and body is just not able to do better. They really want to do better for their loved ones. They want to be better, but they just can't at that moment. And it's painful for family. It's painful for the person who's struggling, who really recognizes that this is not the best version of themselves. And in general, when I get to know people who are struggling that way, they really want to do better. They just can't.
So sad.
It's hard. It's a hard condition, and that's part of why the stigma exists, even among doctors and and all these other lawyers, and is because we like quick fixes. We like to think we can solve this quickly and move beyond it. But I'm very suspicious. Even when people are in recovery, you have to stay vigilant for that substance use and be mindful of it as a family. There's no other spot in my mind. There's only being in there with it.
How how would you suggest that family members deal with that recovery period and that watching out? Because I think that's that. I don't know, we were talking about this before, but it's hard to if someone gets sober, yay, celebrations. We're so happy to have you back. But then you're always on the lookout. You're always like, wait a minute, what's in their glass at dinner? Or they've been out all night. What are they doing? Like how do you handle that wanting to watch out and wanting to monitor after even when they get sober?
It's really hard to rebuild trust in any relationship. If there's, and certainly around substances, it's hard. I mean, there's no easy answer. It takes time. I would say the main thing is when you're in recovery is to figure out a way to lovingly keep it in the conversation where it doesn't feel like a police state or like ideally the person who has struggled and the loved one is communicating about it in an ongoing way. I think that's the way to thrive in recovery is to not pretend like it's something that happened in the past, but it's something that is an ever-present risk. And so the loved one should be asking about it. The person in recovery should be thinking about it, talking about it. It's when there's sort of those eggshells around it, when it's like something that you can't bring up and no one knows, that's where everyone starts to get in trouble. And so even if it means like going to a couples therapist or a family therapist to figure out how to get that communication going, I think that's super worthwhile because I think we all want it to be in the past too. I mean, we can collude with the person. We can be like, ah, they struggled then. I'm sure they're past it now, and just not want to bring it up. And but figuring out how to bring it up in an ongoing way that doesn't have to feel problematic, but can feel loving and like you would bring up anything like, have you taken your heart meds, or should we eat salmon instead of the red meat, or whatever it is.
Yeah, that when you just like couples therapy reminded me of similar process of couples have to deal with like affairs or any kind of betrayal where it's like, how do you not check their phones all the time? Or how do you balance like giving, like trusting them, but also your own trauma of, well, I was trusting and then something terrible happened, but without me knowing. So that's tough.
None of it's easy. No, it's not easy.
Tell me about what you do with the MBA. When I saw that in your bio, I was like, what? What do you do?
Yeah, so I mean, at Cornell, I run our addiction psychiatry fellowship. I do this anti-stigma work and try to combat it in multiple domains. But I do have this cool side gig, which is medical director of the MBA anti-drug program, which is it's more an education piece than anything. It's just letting the players know about the risks of substance use, and they're monitored as part of fair play agreements around making sure they don't use,
Mm.
and then we're here to help them if they need any help along the way, and it's super rewarding. I was a high school basketball player back in the day, and love the sport, and so it's fun to be around the guys. They're so impressive. I always admire how these kids, they're kids, they're in their early 20s, a lot of them, and they're navigating such pressure and money and stresses, and they're great guys. So it's a real fun thing for me to do.
That's cool. Is the risk like any kind of drugs that enhance their perform? Like, are they at risk for? I was thinking steroids, but that's not really.
They're super monitored for that stuff. I mean, that's something that they're like immediately suspended if you test for HGH or these performance enhancing drugs, testosterone, all those things. So like all the sports leagues, and I work with a number of athletes across sports league. They're very strict, all of them, on the performance enhancing
Mm.
drugs these days. That wasn't always the case historically, and there's notable stories of especially baseball players using stuff, but that's one piece. And then the other piece is if they struggle with sort of drugs of abuse, like alcohol or weed or other substances. Although for those they have pretty strict testing, and yeah, they're in this fishbowl. They're tightly monitored, and they're all super conscious about their health. And most of the guys live incredibly healthy. They're mindful of their sleep, what they eat, the training. I mean, the stakes are so high for them. They need to be at peak physical form for these years to maximize their years in the league. I think the average NBA player has like plays for 3 seasons or something like that. So you really have to maximize your fitness during those times.
Are they even at risk for substance use? I mean, like, yeah, as you're saying that, I'm like, if I know I have to train for several hours the next day, I'm not going to party at night. But I guess they're
Yeah.
10-year-old boys, this.
Well, I think as time's gone on, our athletes are incredibly. I mean, they learn how to eat right, how to sleep. People are learning that in high school these days. I think it's. I mean, even compared to NBA pros like 20, 30 years ago, everyone is super health conscious. They know the science. They don't want to do anything to jeopardize their careers. And so, a lot of guys are really careful.
I saw something that said that millennials are the highest drinking generation of forever. Is that true? Are we the I don't know if you're a millennial or not. I don't know how old, but do we drink the most out of everyone?
I think right now I mean, us in the older generation are definitely drinkers. What's striking is the young kids these days are really not drinking. they're even not vaping anymore. They're not having sex. Unfortunately, they're all on their phone. They're all on their phone in their room,
Right, right.
not on social media, which is probably worse. But they're putting us to shame in terms of their drinking behavior for sure. They're a lot less are drinking than our generation and the older generations.
Hmm. Speaking of phones and social media, I don't know if I told you that I worked, one of my first jobs in psychiatry was in the gambling disorders clinic up at New York Presbyterian, New York, at Columbia and NY.
Right.
Yeah. Um, and the whole world of behavioral addictions. Back then it was like gambling and some video games, but now we have those phones. Are are you thinking about like phone addiction as like a an addiction to be treated, or is what are we going to do for that Gen Alpha, Gen Z?
It's an addiction. There's no doubt in my mind. I mean, it's the main behavioral addictions are still gambling and sports betting's huge these days, and gaming and sex addiction, and but the phones are really destroying our youth, and I think contributing to this epidemic of youth mental health issues. I mean, they're designed to be addictive. I mean, that's the whole design of them. And you get it's like a with all these things with the likes, and it's almost like slot machine reinforcement. I mean, you get these things that light up, and your brain lights up, and as a consequence, and they're very hard to pull away from. And so I think ideally, Jonathan Haidt and all these other guys talking about the anxious generation and getting kids off the screen and delaying phones, it's so important, I think. And now AI, I think, runs its risk of all these, other addictions where, it's so easy to get emotional and cognitive comfort from these devices that, now you're getting that in addition to the sort of addictive reinforcement, and kids may never leave their room. They've got these teddy bears that are AI informed, and they're on their phone getting likes, and there's no reason to see the world, and that's super scary.
Well, I hope we do something about it, and in a few years we could look back just like we do with smoking, and we could be like, can you believe that people used to be on their phones on the plane? Like they used to be on their iPads. Like that would be nice.
That's
Um,
the goal, but it's hard.
right? It's hard because it's everywhere, and it's just, then you don't want to be out of contact anyway. There's a whole thing we could talk about with phones, but tell us what you're working on now. Tell us what you want people to know about. You have so much cool stuff going on.
Yeah, I mean, here at Cornell, I think one resource to know about is we have the SAFE program, which is a family support program. We provide sort of monthly education seminars, and as well as free consults for family members if they want to sort of understand how to navigate the world of addiction for their loved ones. And so that's a resource we're very proud of here. And in addition to all the anti-stigma work I do, that sort of dominates a lot of my academic and support life here at Cornell. And then sort of in some ways an extension of that, we have this new podcast called Thriving with Addiction. You'll be a guest on as well, where we, just to explore stories around substance use disorders and learn the latest evidence around it. I think part of why addiction gets so stigmatized is the lack of rounded narratives. And that's true for doctors. They're often seeing people in these acute settings, and they're not getting the recovery stories. They're not hearing from family members about their experience. And when you have narrowed narratives, and the only thing you can think of is the person next to you, then you don't appreciate all how varied the experiences are and how much people can still thrive. And so that's the point of Thriving with Addiction podcast. I have a book also coming out in the same name later this year. And so that's some of the things we're thinking about, how to provide that support for family members, just like you're doing so incredibly with your podcast. It's really a passion of mine, and I appreciate you having me here to talk about some of my thoughts on all of it.
Yeah, thank you. So that's so many great resources. When's the book coming out? Just so we know.
Probably summer or fall of this year, 2026. So
Okay.
date's still to be determined.
We'll keep listeners updated, and when it comes out, we'll add that a link to the description. Also, can anyone join the SAFE program, or is it only for people in person or at
Yeah,
Cornell?
anyone can join. The educational events are virtual. So you can look up the SAFE program at Weill Cornell online. Just Google it, and you can sign up to be on the mailing list. and be informed of it. Also, all the old seminars are recorded there and available for folks to see as well.
Great. And we'll put the link to check that out in the show notes. So if anyone's curious, you could look for the SAFE program link. Dr. Avery, thank you so much for coming on. I could ask you a million more questions. The hardest part about this conversation was selecting the few that I wanted to hit on. But thank you so much for your insight and your expertise. This is like such an important topic. And it's sadly such a hard conversation to have with loved ones. Like it's just, there's so much in there when you're talking about substance use and addiction that I appreciate your perspective on it. So
Well, I'm here also because I'm inspired by you. I mean, the way you've shared your story and the work you're doing is so important, and your honesty, I think will help all of us be honest about this difficult topic. So I appreciate what you're doing, and I appreciate you having me on today.
thanks so much. Yeah, thank you so much, Little Helpers, for listening. Oh man, I really have like 18 more questions in my head, but I'll just save them for another time. Please leave a 5-star rating on Apple Podcasts, Spotify, or YouTube. I don't even know you could rate on YouTube, but we're on YouTube. And if anyone has questions for you, Dr. Avery, is there any place that they could find you and they could reach out or?
Yeah, they can check me out either through my Cornell page or the Thriving with Addiction page. There's somewhere to contact me through the podcast. So there's plenty of routes if you Google me to get in touch for sure. And maybe we can leave those in the show notes as well.
Sounds great. Thank you so much, Dr. Avery. Have a great
All right.
day. And Little
Thanks for
Help
having me.
next week. By accessing this podcast, you acknowledge that the host of this podcast makes no warranty, guarantee, or representation as to the accuracy or sufficiency of information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information purposes only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only, and do not constitute the practice of any medical or any professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The host does not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast. And information from this podcast should not be referenced in any way to imply such approval or endorsement. Thank you.